It's Wendy Bowen here once again with Know Your Body Better. So I wanted to continue with our theme around the knee and talk a little bit about patellofemoral syndrome. So patellofemoral syndrome, you have your kneecap, which is your patella, and it has different grooves and surfaces on it that fit into this part of your femur. And you can see, maybe you can see, maybe you can't see, but the femur has a bit, this distal part has a bit of a groove to it that isn't in a straight line. It has a curve to it. So when you're bending and straightening your knee, that patella has to slide and glide in there. But we don't want the patella too tight down in there because then it's going to get compressed and rub and give you pain. So what controls how tightly that patella is sitting, or the kneecap is sitting in that groove, and how it functions is your quadricep muscle. So that muscle right at the front of the thigh. And so what we're finding with patellofemoral pain syndrome is usually the pain is at the front of the knee, right in here, when you're doing activities such as squatting, getting up from a low position, or jumping activities, going up and down stairs. And what I've been finding, we can treat, a lot of times we think that we're treating the patellofemoral ligament and the patellofemoral tendons. You can treat those, but it might not go away. Again, what I've been doing is coming up and looking, is there tightness, tension in the quadricep muscle, so that muscle at the front of the thigh. So you can massage out these muscles, which take the compression off that joint and help it glide and slide. I know a lot of times too we look at muscle imbalances. So if there's any swelling in the knee, the inside muscle tends to shut down and this outside muscle tends to get tight. So we really have to work on rolling and stretching this one, but firing up the inner muscle. But what I go to first, and what I'm finding really successful, is going to the tightness in the quadricep muscle. So that's your rolling, your stretching. So if you're getting pain in the front of the knee, look at that front thigh muscle, first of all, for patellofemoral syndrome. A lot of times we still have to do some local treatment around the knee and get it tracking right. But release the quads and see if your knee pain goes away. So it's Wendy Bowen with Know Your Body Better.